Hello, welcome to Carter Dermatology, where we strive for excellence and healthy skin. I'm Dr. Wesley Carter, and today I want to talk a little bit about photodynamic therapy. So what is PDT? In a nutshell, PDT is photodynamic therapy, which is a non-invasive two-step treatment that uses a special medicine called aminolevulinic acid, or ALA, that is applied to the skin, and then later a special light is applied. And how does photodynamic therapy work? Well, once ALA is applied to the skin, it is absorbed preferentially and taken up by the sun-damaged and or inflamed cells because these cells tend to be more metabolically active than normal skin cells. Once the aminolevulinic acid is applied, either a red light at 635 nanometers or a blue light at 410 nanometers is shined on the skin where the ALA was applied. At Carter Dermatology, we use a red light. Other clinics may use a blue light. Both are effective. The red light may have better penetration and therefore may perhaps in theory a better treatment response. The interaction of the specific light wavelengths activates the medicine to form what are called reactive oxidative species. These reactive oxidative species are highly reactive and deadly to the unhealthy precancerous and photodamaged skin cells while leaving most normal skin unharmed. The mechanism of action of PDT is to initiate a targeted photochemical reaction within damaged or inflamed skin cells and does not target or damage cells due to heat or mechanical injury as seen in other modalities used in dermatology such as with lasers or chemical peels. PDT has many applications. In dermatology, the U.S. Food and Drug Administration has approved PDT primarily for the treatment of actinic keratoses, which are precancerous, sun-induced rust spots on the skin. PDT is a well-established option when precancerous lesions are widespread and involving a body segment such as the entire face. When lesions are diffuse and widespread, a field treatment like PDT is preferable to liquid nitrogen when treating such broad areas. Beyond the treatment of actinic keratoses, medical studies have explored PDT use in several additional conditions. For example, clinical trials have shown benefits in the treatment of acne, where PDT reduces sebaceous gland or oil gland activity and suppresses the bacteria involved in acne, known as Cutibacterium acnes. PDT has shown at least equal effectiveness as oral doxycycline for the treatment of moderate to severe acne, with a single dose of PDT, one treatment, may be equal to 2 months of oral doxycycline without the additional risk of causing bacterial resistance or disruption of the normal gut flora. Randomized studies have also suggested improvements in photoaging with reductions in fine wrinkles and mottled pigmentation. Additionally, PDT has demonstrated effectiveness in treating some superficial non-melanoma skin cancers, such as superficial basal cell carcinoma and Bowen's disease, also known as squamous cell carcinoma in situ. Although in the United States, these cancers are not currently FDA-approved indications for PDT use. In Europe, however, PDT is more widely approved for these types of cancers. As we mentioned earlier, the FDA has approved PDT for the treatment of precancers known as actinic keratoses. We can also treat photodamage and skin that has signs of photoaging with PDT. We can often kill two birds with one stone when addressing actinic keratoses in sun-damaged skin, which can result in cosmetic improvement and rejuvenation to the areas that we treat. So what's it like to undergo PDT treatment? Well, there are many different protocols, and it kind of depends on what condition is actually being treated. The most common protocols involve applying the photosensitizing agent known as ALA for 1 to 3 hours, followed by illumination with either a blue light or red light, or even daylight in some regimens. The treatment is performed in the office and usually lasts 15 to 30 minutes once the light exposure begins. For best results, actinic keratoses will require about 2 to 3 treatments, usually spaced about 4 to 6 weeks apart. For other conditions such as acne, it kind of depends on clinical response and is kind of more on a case-to-case basis. So to put it all together, photodynamic therapy is a prime example of targeted medicine which uses chemistry, light, and the body's own biology to selectively eliminate problematic cells. While the FDA approval currently focuses on actinic keratoses, research continues to expand its role in acne, photoaging, as well as superficial skin cancers. For many patients, PDT represents a non-invasive, effective option that bridges medical science and practical dermatologic care. Here are my references. Thanks again for listening. If you are interested in a PDT treatment, call and set up an appointment with Carter Dermatology for an appointment, or visit us at carterderm.com to link to our patient portal. You can also contact us or check us out on Facebook and Instagram. We would love to have the honor to help you on your way to healthy skin. Thanks again, and have a great day.